Hello, my name is Luiz Otávio Torres. I am the president of SBU for the years 2024-2025. We are here in the SBU TV, straight from the 39th Congress of Urology being held in Salvador, Bahia. And it's my pleasure being here with Dr. Gerald Brock. Dr. Gerald Brock came from Canada, and he is the president of the International Society for Sexual Medicine. More than this, he's a good friend for a long time, and he's one of the conferences here at the meeting. And Jerry, we're coming here to give some very nice lectures, but would you like, please, what good points of one of your lectures would like to point out for us?
Well, Luis, first of all, it's really exciting to be here in Salvador. I'm impressed with how many delegates they have, the activity and the energy within this meeting. It's amazing. Great sessions, great questions, and a lot of interaction. One of the talks I gave was on evolving therapies for erectile dysfunction. Over the last 2 decades, we've had the total transition of treatment of erectile dysfunction with the onset of PDE5 inhibitor drugs. Over the last decade, though, there's been new energy because we have low energy shockwave, PRP, stem cell therapy, and a whole host of other new evolving therapies. Just in the last week, Mo Kara and his group from Texas published an article about hyperbaric oxygen for treatment of patients who are refractory to erectile dysfunction. There's a study that came out about 10 days ago that looked at central mechanisms for erectile function. So this is an area of medicine that is evolving so quickly. The really exciting part is that for many of the patients out there who've tried perhaps pills or injections or traction devices or pumps, that they sort of felt like surgery with an implant was really their only option. And the truth is, that's a great option for a lot of guys. But for those patients who don't want to go into a permanent prosthetic device, it looks like low energy shockwave particularly is now well researched with very good evidence across probably 50 different studies that looked at longitudinal data and really has shown that in the right patient with the right information, it's a very, very optimal course of treatment for that patient, particularly with mild to moderate vascular insufficiency. So it really tells us a couple of things. One, treatment with PRP or shockwave is safe. But it looks like if you do the right diagnosis and you can uncover the underlying etiology as being vasculogenic in origin, that low energy shockwave probably has a potential role. It's not permanently it's not a permanent treatment in that the data from Vardy and others say that probably for most patients it lasts between 18 and 24 months, and that persisting improvement in erectile function probably is only persisting at that duration of time for about a quarter of the patients with severe erectile dysfunction. But for many men, it's a really nice, minimally invasive way to permanently affect their erectile function. And I think that as research continues and we know more and more about what's happening, we'll actually fine tune the patient, the population, the energy, the location of the energy, and other ways that we can fully affect a really good outcome for a lot of these guys. So for me, as someone who's worked in the field for 30 years, it's really exciting that we have this new avenue of treatment for a whole bunch of patients out there that are looking for something minimally invasive that may be longer lasting than a pill or an injection and aren't ready to have an implant placed just yet.
Yeah, this is fantastic, Jerry. Medicine make an evolution, and urology also follows the evolution of the medicine. And the field of sexual dysfunction should do the same because this is quality of life for the man and for the couple. So I hope all of this comes soon. But another thing that you said very well, that this is not for everybody. You have the right patient and the right treatment in the right moment. So it's not because sometimes, okay, let's do it. And there's
Yeah, Luis, you bring up an excellent point. One of the concerns I have, quite honestly, is that I think urology needs to be more involved. I think that if you look across who's actually delivering this care in many parts of North America, particularly, it isn't urology. And I think we need to take a leadership role in these evolving and innovative therapies because we're the only ones that do a proper evaluation. We're the only ones that take a full history, do an evaluation, maybe even checking vascular flow with a Doppler study. Whereas if it's a physiotherapist who's delivering shockwave, really there's no proper evaluation being done. So urologists need to take a leadership role.
That's it. Thanks a lot, Jerry.
Pleasure.
It's a pleasure having you here again. And thank you, everybody. I'm talking here from the Brazilian Congress of Urology in Salvador, here in the TV SBU.